Hi, my name is Hannah and I'm 28 years old and I have PAH. Before I started subcutaneous Remodulin, I had been diagnosed with PAH for about 7 years, and for most of that time I was just living my life, going to school, hanging out with friends and family, working. But about a year before I started Remodulin, I started experiencing more shortness of breath and dizziness, lightheadedness, and those symptoms were really causing me concern. I chose sub-Q because I just wanted the least invasive and the least interruptions. Since I've started taking Remodulin, I have noticed just a huge decrease in my PAH symptoms, so the shortness of breath and the dizziness and lightheadedness and chest pains, those are not affecting me on a daily basis, and I'm able to work and spend time with people that I care about, and I'm able to make plans for the future without being really anxious that those symptoms are going to get in the way of all of that. I communicate with my doctors and nurses a lot more often, especially during that first 6 months. Whenever I first started sub-Q, I just felt like I had probably a new question every week, or just something would happen that I wasn't sure if it was okay or not. And so for me to feel comfortable and for me to feel confident that I was doing everything correctly and that the pump was working correctly, I reached out a lot, and it was really important for my well-being and just for me to feel comfortable. I really hope that sub-Q Remodulin is going to offer you more than just treatment for your PAH, but that it's going to allow you to get some of your life back and allow you to really move towards goals and achievements that are important to you outside of PAH care.
Remodulin treprostinil injection. Indication, or what is Remodulin? Remodulin is a prescription medication used to treat adults with pulmonary arterial hypertension, PAH, WHO Group 1, which is high blood pressure in the arteries of your lungs. Remodulin can reduce symptoms associated with exercise. Remodulin was studied mainly in patients with NYHA functional class 2 through 4 symptoms. It is not known if Remodulin is safe and effective in children. In people with PAH who need to switch from epoprostenol, Remodulin is approved to slow the worsening of symptoms. Important safety information for Remodulin. Before you take Remodulin, tell your healthcare provider if you have other medical conditions or take other medicines that may affect your use of Remodulin by increasing the risk of side effects or decreasing the drug's effectiveness. Have liver or kidney problems. Your Remodulin dose may need to be adjusted if you have liver problems. Have low blood pressure or bleeding problems. Are taking gemfibrozil for high cholesterol, rifampin for infection, or other drugs that affect liver enzymes. Your doctor may need to adjust your Remodulin dosage. Are pregnant, breastfeeding, or planning to become pregnant. It is not known if Remodulin will harm your unborn baby or if Remodulin passes into your breast milk. What are the serious side effects of Remodulin? Continuous intravenous IV infusions of Remodulin delivered using an external infusion pump with a tube placed in a central vein within the chest are associated with the risk of bloodstream infections and sepsis, which may be fatal. Therefore, continuous subcutaneous SC infusion delivered just beneath the skin is the preferred type of delivery. Worsening of PAH symptoms. Do not stop taking or greatly reduce your Remodulin dose without consulting your doctor. Low blood pressure. Symptomatic hypotension. If you have low blood pressure or are taking drugs that lower your blood pressure, the risk of low blood pressure is increased. Bleeding problems. Remodulin may increase the risk of bleeding in people who take blood thinners, anticoagulants. What are the possible side effects of Remodulin? In clinical studies of SC infusion of Remodulin, most people experienced infusion site pain and infusion site reaction, redness, swelling, and rash. These symptoms were sometimes severe and sometimes required treatment with narcotics or discontinuation of Remodulin. IV infusion of Remodulin delivered through an external pump has been associated with the risk of bloodstream infections, arm swelling, tingling sensations, bruising, and pain. The most common side effects seen with either SC or IV Remodulin were headache, diarrhea, nausea, rash, jaw pain, widening of the blood vessels, vasodilation, and swelling from fluid retention, edema. These are not all the possible side effects of Remodulin. Call your doctor for medical advice about side effects. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. The risk information provided here is not comprehensive. To learn more about Remodulin, talk with your healthcare provider. Please see full prescribing information at www.remodulin.com or call customer service at 1-877-UNITHER, 1-877-864-8437.